waiting for the photographers to be ready.
Now we'll talk about the musculoskeletal system. When you examine this musculoskeletal system, you assess the bones, muscles, and joints that support the body and allow movement. You also evaluate the system that protects vital organs, produces red blood cells, and stores essential minerals. To help you assess this versatile system, this program will show you how to perform a complete musculoskeletal examination. Throughout the exam, you'll see normal findings. Bear in mind that you may see these findings, normal variations, or abnormal findings in your practice.
Before examining the musculoskeletal system, consider its anatomy. The skeleton is made up of 206 bones. Many of them are connected by joints, which allow mobility. Non-synovial joints unite bones by fibrous tissue or cartilage. They may be immovable, like the sutures in the skull, or only slightly movable, like the vertebrae. Synovial joints are freely movable. They separate bones from each other and are enclosed in a joint cavity filled with a lubricant called synovial fluid. In these joints, cartilage covers the surface of opposing bones. The joint is surrounded by a fibrous capsule and is supported by ligaments. A bursa is an enclosed sac filled with synovial fluid. Bursa are found in potential friction areas, such as the knees and shoulders. Skeletal muscles contract to produce a wide range of movement.
So if you'll take a seat on the table, we can begin the exam.
During the musculoskeletal examination, plan to use this order to assess each joint. Inspect the joint and skin, noting joint size and contour, and skin color and characteristics. Palpate each joint, including its temperature, muscles, bony articulations, and joint capsule. Test range of motion to detect any limitation. Test muscle strength by applying an opposing force as the person performs range of motion. With the person seated, examine the temporomandibular joint. Inspect the area anterior to the ear. Place your fingertips in front of each ear and ask the person to open and close his mouth.
Now I want you to open your jaw as wide as you can.
Now ask him to open his mouth maximally. Normally, the space between the upper and lower incisors is 3 to 6 centimeters.
Good. Now I need you to open your mouth partially and move your jaw from side.
Then ask him to open his mouth partially and move his lower jaw from side to side. Normally, he can move it 1 to 2 centimeters.
Now open your mouth partially.
Also ask him to stick out his lower jaw. It should protrude without deviation.
Now I'm going to examine the muscles of the jaw. I need you to clench your teeth.
With the person clenching his teeth, palpate the temporalis and masseter muscles. Compare the right and left sides, which should be the same in size, firmness, and strength.
Now, if for the final
Now I'm going to be checking the strength of your
face,
jaw
you
muscles.
would be doing
I'm going to
this.
touch your face.
Ask the person to move his jaw forward and laterally against your resistance, which he should be able to overcome.
Good. Now I need you to sit up straight so I can examine the head and neck area.
Inspect the person's head and neck alignment. The cervical spine should be straight and the head erect. An older adult's neck may show an increased concave curvature and a backward head tilt to compensate for spinal kyphosis.
Now I'm going to lower your gown. Tilt your head forward just a little bit, please.
Palpate the spinous processes and the sternomastoid.
Good.
Trapezius. And paravertebral muscles. They should feel firm and non-tender. extension of 55 degrees.
Tilt your head to the right as far as you can.
Lateral bending of 40 degrees to the right and left.
Now turn your head to the right as far as you can,
And rotation of 70 degrees to the right and left.
and to the left.
Each movement should be smooth and controlled.
This time we're going to do it with some resistance.
Test muscle strength by applying resistance as the person repeats these motions. He should be able to resist your hand pressure equally in all directions.
Good. Now I'm going to take a look at your shoulders.
Inspect the shoulders, posteriorly and anteriorly, checking the joint's size and contour, and the shoulder's bony landmarks. You should see no redness, atrophy, deformity, asymmetry, or swelling. Next, palpate both shoulders, starting at the clavicle. Explore the acromioclavicular joint, subacromial bursa, greater tubercle of the humerus, glenohumeral joint, biceps groove, and scapula. You should detect no muscle spasm or atrophy, swelling, heat, or tenderness.
Okay.
Now test shoulder range of motion by asking the person to perform 6
We're
movements.
going to examine the range of
Cup your hands over his shoulders to detect crepitus, which should not be present.
arms above your head.
During range of motion testing, you should see forward flexion of 180 degrees.
Good. And take your arms behind you as far as they can go.
Hyperextension up to 50 degrees.
Good. Now I'd like you to take your arms, reach behind your back, and try and touch your shoulder blades with your hands.
Internal rotation of 90 degrees.
Good. Now take both arms, raise them up above your head, and put your palms together.
Abduction of 180 degrees.
Now take your right arm. As you lower it, sweep it across the front of your body as far as
Adduction of 50 degrees.
Good. And the left. Good.
And external rotation of 90 degrees.
You can have a seat on the table. We're going to continue with the evaluation of the strength of your shoulder.
Then test the strength of the shoulder muscles
And I want you to
by
shrug.
having the person shrug against your resistance, which he should be able to overcome.
Now we're going to examine your elbow.
Inspect the elbows in the extended and flexed positions, particularly noting the olecranon bursa and olecranon process.
Good.
You should see no deformities, redness, or swelling. With the person's elbow relaxed and flexed about 70 degrees, use your thumb and fingers to palpate the olecranon process and the medial and lateral epicondyles of the humerus. Normal tissues and fat pads should feel fairly solid. They should have no synovial thickening, swelling, nodules, or tenderness. Also palpate the olecranon bursa, which normally is not hot, swollen, or nodular.
We're going to continue on with the exam and check your range of motion of your elbows. I want you to
Then test range of motion
in,
by having the person perform elbow movements. You should see flexion of 160 degrees, extension at 0 degrees.
and same with the left. Good. Now I'd like you to put your elbows at your side, hands out in front of you. I want you to
Pronation of 90 degrees. And supination of 90 degrees.
Now I'm going to check the strength in your elbows.
To test muscle
I want
strength,
you to resist.
stabilize the person's arm with one hand.
Now push.
Then have him flex his elbow against your resistance. Also ask him to extend his elbow against your resistance. He should be able to overcome it.
Now I'm going to check your hands and wrists.
Inspect the wrists and hands. Normally the wrists are in slight extension. The fingers lie in the same axis as the forearm, and no swelling, redness, deformities, or nodules are present. The skin should look smooth with knuckle wrinkles and full muscles. Now support the person's hand with your fingers. Relax and straighten his wrist, and palpate it firmly from side to side with both thumbs. Normally, the joint surfaces feel smooth, with no swelling, bogginess, nodules, or tenderness. Palpate the metacarpophalangeal joints with your thumbs just distal to and on either side of the knuckles. Then, using your thumb and index finger in a pinching motion, palpate the sides of the interphalangeal joints. Normally, no synovial thickening, tenderness, warmth, or nodules are present.
Now I'd like you to put your arms at your side.
Next, test range of motion by asking the person to perform wrist and hand movements. You should see wrist extension of 70 degrees,
Fingertips up, flexing your hands upward,
wrist flexion of 90 degrees,
and hands all the way down, pointing to the floor. Good.
finger hyperextension of 30 degrees at the metacarpophalangeal joints, finger flexion of 90 degrees.
Now keeping your arms at your side, I want you to try and turn your wrist
Ulnar deviation of 55 degrees,
to the middle,
radial deviation of 20 degrees,
to the middle, and spread your
and finger abduction of 20 degrees.
Good. Now I'd like you to make a fist with each hand.
Also ask the person to make a tight fist,
Good. Now I'm going to have you touch the thumb to the tip
and then touch the thumb to each fingertip
and the base.
and to the base of the little finger. The response should be equal bilaterally.
Good. Now I'm
For
going
muscle strength
to
testing, stabilize the person's supine
try
forearm.
and straighten out your wrist. I want you to
Ask him to flex his wrist against your resistance at the palm.
Good. Same on the other side. Good. Now I want you to take the backs of your hands and put them together, keeping your elbows bent.
Next, perform Phelan's test. Have the person hold both hands back to back while flexing his wrists 90 degrees. When held for 60 seconds, this position should cause no numbness or burning.
See your wrists. Good.
Also assess for Tinel's sign by percussing over the median nerve in the wrist. This should cause no burning or tingling, which is Tinel's sign.
Anything or tingling at all?
No, just a bit.
Good. Let's try the other wrist. Any discomfort at all?
No.
How about now?
No.
Good. I'm going to examine your hips now. You can lay back.
Although you'll inspect the hip joints with the spine when the person is standing, palpate the hip joints while he is supine. They should feel stable and symmetrical, with no tenderness or crepitus. Next, assess range of motion by having the person perform certain movements. You should see hip flexion of 90 degrees with a straight knee.
Good. Keeping this leg straight, I'd like you to bend the other leg into your chest.
Hip flexion of 120 degrees with a flexed knee.
Good. Now I'd like to have you bend your right knee, put your foot right on the table flat.
Internal rotation of 40 degrees.
Towards me. And now to the opposite side as well.
External